corruption in our democracy. President Trump had a chance to build on the work of President Biden to put into place basic, humane, dignified minimum staffing levels in nursing homes all across the country. This is absolutely necessary for the care of our elderly and disabled. The fact of the matter is, in many nursing homes, especially the for-profit nursing homes, especially the nursing homes owned increasingly by private equity firms, there is nowhere near adequate staffing. There is nowhere near the number of care hours that patients need to be well and to recover, but there is nowhere near enough staffing to make sure that workers are protected, to make sure that their safety is prioritized. Because in these homes where you don't have enough workers for the patients, it jeopardizes both the patients and the workers. And after years of advocating for a meaningful, dignified national staffing ratio, President Biden put those wheels in motion, and the staffing ratios, the increased required staffing in our nursing homes, good for patients, good for our elderly, good for workers, were due to go into effect. And this is where the corruption comes in. What we learned is that last summer, some of the biggest nursing home companies, some of the most profitable nursing home companies in the country, started to lavish massive donations on Donald Trump. Over the course of last summer, they put at least $5 million into Trump's political operation, in particular one of his big super PACs called MAGA Inc. And not surprisingly, mere weeks after they showered him with $5 million in donations, they got a private audience with Donald Trump at his DC area golf course, where they told him what their price was for continued political support: the abandonment of the increased staffing requirements. Within days, Trump relented. He told his people at the White House and the Department of Health and Human Services to get rid of the new staffing requirements, and they are now gone. And that's going to put our workers at risk. That is going to put patients at risk all over the country. And for what? The nursing home owners will tell you that these ratios are too high, that they're impossible. Well, that's a lie. That's just a lie. These nursing home owners have gotten used to making themselves filthy rich off of taxpayer dollars. Remember, 85% of revenues that come into most nursing homes come from all of you, come from all of us. It's Medicare and Medicaid that pay for the operations of most nursing homes. And many of these nursing home owners are raking in just disgustingly high salaries. One of the most vocal opponents of the nursing staffing ratio proposal is somebody named Barry Post. He runs a group called the Ensign Group, and it runs nursing homes all over the country. Barry Post's compensation package last year was $10 million. Don't tell us that you can't put a few more nurses, a few more CNAs on the job when you and your executives are raking in $10 million a year, buying your third and fourth home. That's a corruption of taxpayer dollars and a corruption of our political process. So we just wanted to shed light on this and to let the people of Connecticut know what this is going to mean for residents, what this is going to mean for worker safety. And Dick and John and I are committed to keeping this fight going. Senator Blumenthal talked about a piece of legislation that we are all supportive of that would put those nursing home ratio requirements into law. That'll be a hard fight with the Republican Congress, but we're not giving up. And I appreciate that 1199 is never giving up either. So let me turn this over to our great list of speakers. Obviously, you're from Dick and John, and then Murray Painter, who is the state's long-term care ombudsperson, talk about the impact statewide. Then Johanna and Dory will give you an on-the-ground view of what this means for workers and patients, and then Rob, on behalf of SEIU 1189, will finish it up. So let me turn this over to my partner in the Senate, Senator.
Thank you, Chris. Thank you for bringing us together today. But most important, thank you to the workers who are here. Thank you to the nursing home caregivers who are here. Thank you to the union leadership who are here. Unions make us strong. Unions make us unified and make us stronger than we would be individually, and that's why you're being here. Thank you to Rob Burrow and his army of justice advocates. We're fighting here for justice against a scandal. It is a scandal that nursing home operators and owners are failing to pay the qualified, skilled caregivers who make the difference between life and death in these facilities, literally the difference between life and death, and quality and safety. You know, let's talk about what you folks do. From morning till night, and then into the night, you are there for people who need care, to bathe themselves, to eat, to go to the bathroom, to do basic living functions. You were there to lift them, to feed them, to enable them to have a life, literally, in nursing homes. Whether they are seniors or injured, disabled, these folks are the ones who provide such essential care. And all they're asking for is basically a living wage, adequate compensation, benefits, health care. And nursing home operators are making a ton of money. Chris has said it very eloquently. They are disgustingly well-to-do and well-paid. And part of the reason is they're profiteering off the backs of the people who work for them. Again, these are skilled, dedicated, and extraordinarily hardworking folks who are there to bathe, feed, care for people in nursing homes, and by the way, also in assisted living and in home care. And that's why I've proposed legislation. Chris and John are supporting it. Over the years, I've advocated for legislation that would establish basic minimum standards for how many of these workers are there for each of the patients to avoid bed sores or falls or starvation or simply lack of quality of life. These caregivers deserve basic fairness and decency. That's America. Well, the legislation has never passed because, bluntly, the nursing home operators and owners have such sway, they're able to make campaign contributions, and they bought out President Trump after regulations were adopted by President Biden. In short, the President of the United States, then Joe Biden, thought these standards were such a good idea, he adopted them in regulation. President Trump sold out the seniors and the residents in these nursing homes. He sold out these workers. He was bought out by the industry. That is a scandal. And it ought to enrage every American, because one day, almost every American will depend on these workers. for themselves or someone they love or a neighbor or a friend. At some point, we all need care. And these caregivers need to be fairly compensated. And that's our job, to assure that we adopt in legislation, not just by regulation, but in binding law, in the statutes of the United States, the protections that these caregivers need so they can be more effective. If you pay someone fairly, they will be more effective than if you profiteer off their backs. So it's really to our benefit, it's to everyone's benefit that this legislation be adopted. I'm going to fight for it. I know that John and Chris are committed to fight for it. Your being here today, these caregivers being here today, gives us additional energy and impetus. Standing with 1199 always energizes me. You guys are the best. You're really the best. You stand strong for union members, for working families, and we are, as that sweatshirt says, always stronger together. Stronger together. Thank you so much for being here today. We're going to continue this fight, and I want to introduce a great friend of working people, of nursing home residents, of 1199, and a friend of Chris and ours, the great congressman from the 1st District in Connecticut, John Martin.
Well, thank you, Senator. I want to thank both Dick and Chris for putting this together. We're blessed in the state of Connecticut that we have an outstanding congressional delegation. All 7 of us pulled together, but we're led by 2 remarkable leaders in the United States Senate, and Chris Murphy and Dick Blumenthal. That's why I'm proud, as are all the members of the congressional delegation, to support this legislation, because we see it for what it is. And you would think, with Donald Trump always talking about Joe Biden, that he would have mentioned how he improved upon this, how he made sure that there was access, that the caregivers of 1199 and nurses, my sister is a nurse, and I just came from the VA where we had a discussion about nursing and care and how important that is. But I want you to think of this. 10,000 baby boomers a day become eligible for Social Security. That means they're at that age, an age where they require more health care than, or 10,000 a day. The point being that Chris and Dick underscored, that this need isn't going away. It is growing exponentially. And here's the rub. Chris said it best. This is taxpayer dollars. This isn't private sector money. This is the money of every American citizen